So anyway, I want to thank everybody for joining us. We had a really great day yesterday, and I think we're really getting the understanding of where 2021 is going, where it's going to be. We had some fantastic commentary on real estate and where people are expecting there to be opportunities in real estate. Of course, David Drake spoke, and he was talking about just the nature of entrepreneurialism and success and failure of investing in 500 companies. And of course, he talked about crypto and some of the new things that he's working on. We had a great panel that spoke on the economic outlook. And of course, we think that there's going to be a lot of, fiat currency being printed in 2021. And under the impression that we have a concerted fiat currency printing press going on all around the world by all the central banks. So that naturally led us to a discussion on cryptocurrency. We had a cryptocurrency trader who has done a stunning 800% return last year, exceeding Bitcoin. And he was talking about some of the things that he was looking at. Then we had extensive healthcare discussions and healthcare panels, some great venture capitalists speaking. We topped it up with Pat Saldana, who's really just a fantastic person. If you know her individually, I've known her for about 20 years. She used to run GenSpring. She runs a variety of not-for-profits that are focused on family business and inheritance taxes. Many of you might know that there are many family-owned businesses out there that when the entrepreneur dies or the next generation dies, because of tax law, a lot of times companies, individuals have to sell their shares to keep governance. So there's dilution that happens, and that dilution sometimes leads to negative impacts for the employees. So that was really fantastic. Today we've got a great set of speakers. We're going to start off with Fred Nazem. Also, I wanted to reintroduce Robert Butler again. Robert's going to be co-hosting. Robert, can you just again reintroduce yourself to the group?
Hi, Robert Butler, currently based in Tucson, usually based in Austin. I've been participating in Marty's events since I think 2011. Independent consultant. I primarily work with investors on sourcing and evaluating investment opportunities, especially small niche alts. And I'm currently working with a private intelligence firm. So looking forward to another interesting day of conversations. Thanks, Marty.
Fantastic. Thanks again, Robert. Again, we're going to start with Fred Nazem. We're not going to get to Fred yet. So we have really some fantastic panels. So something that's kind of been percolating in my mind is that there's been this explosion in podcasting. So I've got a couple of VCs who invest in podcasting or alternative media specialists. And then, of course, we know there's been an explosion in gaming, especially with COVID. So just to give you an insight, probably 15 years ago, online gaming and just gaming in general was about 1/3 the size of Hollywood, which is about 8 billion back then. Today, the size of Hollywood is somewhere around 12 to 15 billion. And as we know, the movie business is in significant decline because nobody's going to movie theaters. But however, gaming has exploded. The gaming economy worldwide is somewhere around 150 billion and getting bigger faster. And you see people who have, games on their cell phones, video game consoles, etc. So they enjoy games. Me, myself, I'm a board game guy. So if you have any good board games, please suggest them. I'm not really a gamer, but I love board games. Later, we have a panel on Fintech, some really fantastic speakers on Fintech. So Fintech's going through another explosion in valuation. As we know, following 2008, there was a great expansion in Fintech. We have like PayPal, Square, so many of these companies that came along out of nowhere and then just they took over white space, or they took over things that we formerly identified with banking. One of the things that I'm always concerned about or something I'm interested in is the role of Fintech with the unbanked, and how Fintech has the ability to skip generations of banking and financial services, just like mobile phones did for people who didn't have phones. So again, the old study was that people assumed that people would go through with mobile phones. They'd have to go to the wire first before they got used to phones, et cetera. But that didn't happen. People went right to mobile and mobility. So, and we've got great speakers there, a series of family officers speaking, et cetera. Rick Stream is going to be speaking. Rick Stream is a company in New York City. They do some 401k management. products, and they've had a lot of success this year with growth despite COVID. Then, of course, as I said, we're going to have Dan Moorhead speaking. Dan's kind of been at the forefront of crypto for many years. We've known him since around 2014. Some of you who may have been down in Miami back in 2015 and 2016, he wasn't the guy, but you may remember the guy that was giving out $15 to $20 a bit of Bitcoin back in the day when Bitcoin was like 600. I think that's kind of worth a lot now. And I've had people calling me saying, how can I find out where my wallet is? So after that, we've got a great group of women-led alternative strategists, general partners, et cetera. I'm really happy we're going to have the Innovation Fund, Urban Innovation Fund is going to be speaking. They've been a great success. They presented to us about 4 years ago in San Francisco, have had some growth, but they're like a smart cities company. And I think smart cities is another area where you're going to see expansion and growth, especially in the area of city security. Then we've got, Alan Snyder, who's a esteemed member of our group, will be speaking on art lending. We've got a manager selection panel, and then I have a family office deal making panel that will have Lawrence Richards speaking. Lawrence is a guy that we've known for 10 years, has been presenting with our group all over California and New York. And also Carol Pepper will be presenting. Carol's very well known, esteemed. She's routinely named one of the top sources of advice for European family offices. And then we also have Mauro Andreotti, who's going to be speaking on 2 panels today. He's a fintech guy who has a family office as well. So we're really looking forward to it. Just give me 1 second here while I go back to the camera. And so I want to introduce Fred Nazem. Fred, I've known for many years now. He's had a really clever product named Rejuvenon. I mean, Fred, before that, he was a venture capitalist. He still invests in deals. Has had some great success with some of the deals that he's invested in recently. And he can talk about that himself. But Fred, why don't you introduce yourself, talk about Rejuvenon. I'm going to stop this poll and then publish the results, and then you can take a look at it and see where you want to go from there.
Okay. Well, good morning, and thank you very much, Marty. This is yet another one of your great gatherings, and I got to say, yesterday, I really enjoyed some of the sessions that I was telling you about. And having talked with you earlier today, I think I'm going to change the nature of my presentation today. I was going to split the 25 minutes that you've given us into 3 pieces. One small piece with, for me, about 6 or 7 minutes of it, to tell you about the major trends in medicine that as a result of COVID and the changes that has happened. And I'll just highlight them now instead of going details of them, because I think your questions and answer sessions are going a lot to those very, very, very.
And so they're all vying for theories. And
I'm sorry?
Hi, can you turn off your volume, please? Thank you.
Anyway, can you hear me?
Yes, I can hear you. Good.
All right. So what 2020 will go down as a very, anyway, so in terms of housekeeping, my colleague and the president of Rejuvenon, Rishi Madhak, MD, is going to be joining this conversation and presenting the telemedicine, telehealth, and in that context, essentially what Rejuvenon is up to. A lot of your questions I just see is relating to that. So we'll then spend, after he presents his piece, we'll have hopefully 7-8 minutes to answer questions directly. In any event, so the bottom line for me is that 2020 will go down as a truly disruptive year. We all know this. The COVID-19 basically revealed, for instance, the many ossified aspects of our healthcare system. It stopped the nonsense that it takes years to develop a vaccine. Well, we got it in less than 1 year. It stops the nonsense that regulatory agencies will not allow you to do a vaccine less than 5 or 6 years. Things will take forever. They became a tailwind, and I expect that become a norm going forward. They essentially, they said, I'm sure, Marty, you remember from the past conversation, early days of Rejuvenon, when I was talking about it, people really didn't know anything about telemedicine, telehealth. We kept telling them about it. It just took 1 month, 1 month to go from 1% recognition and use to 40% recognition and use within this short period. So telemedicine suddenly became the front door to medicine. And Rishi will talk a little bit more about it. But let me just highlight 8 things that I see among several more. But I just want to highlight 8 places where there's opportunity for asset building and investment. One area is, and I think it's not hidden, but it's coming forward very fast, importance of patient data. We relied on professional data and doctors' notes in EMR, and suddenly patient data is becoming more and more, as consumers are using it, particularly in telemedicine, telehealth, patient data became very important. We always thought it was the most important, but together with EMR or EHR, you have the 360 view of the patient. And this is going to become much, much more evident in the next 5 years. So the second area is unbundling of what I call health insurance. I know I ran Oxford Health Plan as the chairman and CEO, and so I have some understanding of healthcare insurance. I think people, as they got laid off, and the numbers grew, they didn't have healthcare coverage. They ran for coverage, and they found out how much they're on the hook for the expenses, their healthcare, how expensive it is, and how difficult it is to deal with the mumbo jumbo of insurance. And that's where what you were talking about, fintech is going to come in, will make it a lot easier. I think a good example is the company Lemonade that went public. They're not in the healthcare side of insurance, but they're in the other side. And it's just growing like crazy. I think easier insurance is in the picture. Number 3, in terms of importance, I think is going to be the higher acuity of virtual care. Telemedicine, telehealth was for leitmotif overnight problem and would get rid of 90% of your problems, but there was always a 10% difficult one, and there is more intensity in terms of MD participation. I think you're going to see telemedicine opening much wider, including a lot more procedures that people thought it was only belongs to the hospital and OR rooms. And we can go into some details of that. The fourth thing that I wanted to cover, and I see areas of tremendous interest, is the entrance of drug distribution companies, RXs, and laboratories into this whole area, into the village of healthcare delivery system. They will become increasingly a delivery mechanism of healthcare, and they participate in it. I think GoodRx was a good example. Discounters, and then they started talking medicine, and they look at what happened to them. So it's very exciting. The, the, the next one, and I think it's probably the most important development, together with the Moderna thing that we'll talk about in a minute, is what I call the 3 musketeers, the convergence of DNA sequencing, artificial intelligence, and gene editing. When you see gene editing, like CRISPR, or something that one of my companies that I was a co-founder of, Bluebird Bio, by the way, 2 days ago, they announced they're going to divide the company into 2 pieces. This was a company I couldn't give it away, by the way, for years. And then finally, we broke through, and with the product of replacing bad genes with good genes, and became a national sensation. And the company is multi-billion dollars now. But the bottom line is, this whole area is coming together of 3 things: convergence of DNA sequencing with new sequencing machines, particularly another company I'm involved with, Genapsys. Again, I offered to Marty's group before, and we just had another financing with the company at closer to $1 billion valuation. And because this company does the sequencing at very reduced price on a handheld basis, and accuracy as good as Illumina. So it's a big thing coming. It's private. It's going to come out. So that area of gene sequencing and CRISPR type of editing of genes, and artificial intelligence, which is really present in all of the things that I'm talking to you about. So I see some huge areas of opportunities. We can go talk about it. Then there's the antibodies. We've all got to know what antibodies. Antibodies fight disease in our bodies, but they can also be created to control disease-causing proteins. These tools are particularly effective in the so-called tumor microenvironment. I won't go into details of it. For cancer, for instance, cancer cells hide in proteins, and there's now new trends in so-called bispecific tumor antibodies, where it's like a letter Y, and the two antennas. One antenna is a way to camouflage, take the camouflage off of the cancer and stop the cancer from growing. The other one has got either an element of setting off the immune system to go fight it, or having a drug therapy to go in it. So in a microenvironment around the cancer cell, they can really get to the cancer, block it, get rid of it. So next area, next of the last two that is left, I would say messenger RNA antibodies. I don't want to go into a lot of detail. So many people have learned about it, but what Moderna and Pfizer, and particularly Moderna, did is incredible. It's more than just a vaccine they came up with. They came up with a whole platform. This platform technology in biotech is going to be the most valuable going forward. You don't have to even wait a year to develop a vaccine, new one, if something else shows up. They can do it in months because of these platforms. This platform also goes far beyond the vaccine that we are talking about to a lot of different developments for cancer and other places. Again, subject of great interest and talk. Finally, I think genomics for the masses is here. Human genome was sequenced 20 years ago, but only recently it has come to be of wider use. What is very exciting is 5 years ago, hardly anybody ordered anything in PCPs, never ordered anything in genetics. But now 60% of PCPs have at least one genomic test they've done for themselves or their patients. So this is going to become much bigger thing, particularly with a trend called polygenetics risk factors or risk score or PRS. This is risk stratification based on thousands of different genomic variants that you go for a test and you find out if you're really susceptible to certain diseases. For instance, if you have susceptibility to Alzheimer, by just doing this kind of a test, you'll find out your APO4, which is the gene that causes Alzheimer, and what variant of it is, could be identified early. And there's some great hope that if you get it early, you could do something about it. I stopped there. In summary, it is hard to imagine what the tectonic effect of these cohorts of modern tools are going to do. I just had 8 of them for you. It's probably double that number. The trend I just outlined will essentially, with the regulatory tailwind, is going to do wonders for us. So welcome to the new world of medicine. It is just an exciting thing. I'll stop there and answer any questions. But next is Rishi, who could talk about Rejuvenon, but more importantly, that whole space that we are in, if there's any question.
Why don't we move to Rishi? But we do have a lot of questions. And as a matter of fact, we're running a second poll on where the investors invest, and they wanted to get some more information about what you think is the most exciting field outside of healthcare IT in healthcare investing. But why don't you,
Now let's have Rishi talk, and then we can both answer, because he's just as interesting.
Fantastic. So Rishi, take it away.
Awesome. Thank you, Marty. Thank you, Fred. It's wonderful to see you, and hopefully we can see each other in person soon. Thank you, everybody, for your attention. My name is Rishi Madhok. I'm the CEO for Rejuvenon. I'm going to talk to you about our digital health platform that delivers a concept that I was happy to hear about yesterday, when we've been espousing for some time, whole care, telemedicine, and telehealth to our members through a personalized Rejuvenon experience that's powered by a deep tech stack. We've had fantastic partnerships in this past year evolve and have a tremendous growth rate. One of our best partnerships is the City of New York and the Department of Aging. And as I speak to you, and I promise to be brief, we are in the process of raising a Series C to further fuel our growth, as well as looking at early access or early vehicles to public markets through either IPO or SPAC. But as I mentioned, it's trite to say, because so many have said it, that this year has propelled healthcare and the practice of medicine. What we couldn't do in 10 years, we did in 10 months. Because of factors such as COVID, healthcare and telemedicine has been pushed to the virtual front door. We are the virtual front door to healthcare. And what's emerged is relaxation and restrictions around telemedicine, increased reimbursement, and a forced adoption by doctors, by patients, by health systems, and by payers. But what the market has also realized is that sticking a camera in between a patient and a doctor isn't enough. If you look at companies such as Teladoc and Livongo, they came together not to just provide more telemedicine, but to provide this whole care piece, to provide an engagement with the patient that was personalized to them, that empowered them and stayed with them to help drive them through the complicated process of healthcare, to really give them a return on their investment, which is really a better life. And that is something I know for those of you who've seen the Rejuvenon presentations, you've seen this chart before. Rejuvenon has been developed for years now to add years to your life, as well as life to your years. And we do that through the Rejuvenon clinical wellness platform, through our approach to whole care, which couples telemedicine, we have our own nationwide practice of physicians, with our telehealth, combining in care, content, and communities that are curated and specialized for each member in their own unique Rejuvenon experience. And the entire experience was founded in hard science that won the Nobel Prize back in 2009, focusing on mitochondrial and telomere research, and has expanded since then. So when you come onto the Rejuvenon platform, as I mentioned, a member is able to access our physician network, whether it's a medical visit, mental health, nutrition, as well as wellness support, being able to meet them where their need is. But their experience is governed and objectively scored through a Rejuvenon health score, taking 10 biomarkers where we took the time to understand the research of how do we engage patients and really prevent the disease of aging and all the chronic disease that goes with aging. These 10 biomarkers were what we found that we could measure and intervene upon through traditional medical therapies, as well as the Rejuvenon health experience that I'm going to go on to describe. The health experience comes from our own content that we've developed. We are a premium content service in this regard. We have not just anybody, but Nike, Lululemon, brand ambassadors running you through your workouts. We have New York Times 3-star chefs, not just providing you with a nutritious meal, but one that's you can actually make and is actually delicious as well. Our members have an experience because we've taken the consumer first approach to the delivery of our whole care. And we create everyday relevance through challenges, rewards that are specialized to our members based on their need, and engagement through online communities. So you can connect with members who are experiencing health in the way that you are as well, to know that you're not alone in your process of healthcare. So we create a personalized and engaging platform where you can connect to your traditional medical therapies, as well as the entire true telehealth experience. That's whole care. Now, how do we do it is really a bit of the secret sauce. We don't just take our physicians and throw it at the patient. Yes, we do have physicians who staff all 50 states, but really when you come onto the platform, as I mentioned, we use our clinically validated and scientifically validated Rejuvenon health score. Oops. We use our Rejuvenon health score to drive a risk detection and treatment engine, which basically looks at our patients and their risk for diabetes, hypertension, and the other chronic disease that comes with aging. And we provide a recommendation, a Rejuvenon experience, which started out as a few hundred experiences that we could drive members through. But now that we've coupled the system with machine learning and really a deep neural network, we're able to create thousands of experiences that basically align with the member. What do they want? What do they need? What are they at risk for? And what are they most willing to do? We drive content, community, as well as medical intervention and visits through our platform to get them there. Again, adding that years to your life and true life to your years. Along the way, we're